All right. Hi, my name is Nicholas. I'm a student physical therapist at University of St. Augustine. Can I go ahead and get your name and age, please?
Wes, I'm 35.
Wes, I'm 35. All right, Wes, what seems to bring you into physical therapy today?
So I'm getting this hip pain in my on my right side.
Right hip?
Yeah.
Okay. Can you kind of like pinpoint where the pain is by any chance?
Yeah, so it's like over here.
Okay. So more towards on the side of your hip, not really in the front, not really in the back.
Yeah, more on the side.
Lateral hip, side of the hip. Okay. What do you think's going on? Like, what did you do? Did you hurt it or something?
Yeah, so I was running and a half marathon with my wife, and it just kind of started gradually.
Okay. Gradually started hurting.
Yeah.
Can you kind of describe the pain you're experiencing? Like, is it, dull, achy, stabbing?
It's achy, but I get like intermittent sharp pain.
Okay. So the majority of the time you would say it's like achy pain, but
Yes.
once in a while you get sharp?
Yes.
And what makes it sharp?
Just running.
Okay, so when running.
Yeah.
Okay. When did this all start? When did you run that half marathon?
3 months ago. I noticed it like 9 miles in.
Okay. 3 months ago,
Yeah.
9 miles in. Okay.
I also get this like snapping sensation too, like when I've been using the Stairmaster.
Okay.
Yeah.
Snapping.
Yeah.
So when you're climbing stairs, you feel snapping.
Yeah.
Can you also describe it as like maybe a clicking or a catching, or what do you mean by snapping?
That's just what it says. Snapping.
Okay.
Yeah.
Snapping, okay.
Yeah.
So snapping when climbing stairs. Okay. So 3 months ago, the half marathon, since then, would you say it's been getting better, staying the same, worse?
It's been getting worse over like the past 2 weeks.
Getting worse.
Because I've just been like using the treadmill and the Stairmaster a lot.
Okay. Have you noticed any like warmth or swelling in the area at all?
No.
No. Okay. Did you go and see your medical doctor for this at all?
No.
No. Okay. So I assume you probably haven't had any imaging done then either.
No.
All right. So these are kind of symptoms outside of why you're kind of here, but I kind of just need to go over it real quick. Have you also maybe experienced any like nausea, vomiting, upset stomach,
No.
like recurrent night pain or anything?
No.
Okay. Notice any like skin rashes?
No.
Okay. Any like chest pain?
No.
No. Okay. So like, what do you do for work?
I'm an accountant.
You're an accountant. Okay. Would you say that this hip pain has been preventing you from doing things at work at all?
No, not really.
Okay.
Just pretty much running and the stair climbing.
Okay. Other than work, what about around the house? Do you have any difficulty with anything in the house? Do you live in a 1-story or 2-story?
I live in a single-story house with my wife and 3 kids.
Okay,
We
so
just like to like go to the beach and walking around SeaWorld.
Okay.
Yeah, that's pretty much the running and stair climbing that's giving me the problems.
Running, stair climbing, okay. So like currently you would say your main like issues are running, which you like to do in your free time, and then just climbing stairs.
Yes.
But you live in a 1-story, so it's not every day that you're having to climb stairs.
Yes.
Yeah, okay. And prior to this injury, you had no issue with running or climbing stairs?
Correct.
Okay. Alright. So I know you said that it's like achy and intermittent, sharp. Have you also maybe experienced any like numbness, tingling,
No.
shooting, electrical type pain, nothing like that? Okay. Alright. Okay. Have you gotten any like treatment for it at all?
No.
No? Okay. No treatment, okay. Have you possibly injured that right hip before in the past? Like gotten any surgery done or anything?
No.
No. Okay. All right. Okay. And you said that's right on the side of your hip. Okay. Let me just write a couple notes down.
So like my ortho MD buddy was saying that like I'd like probably need some like steroid injections.
Okay.
That sounds like it's maybe like a bursa.
Okay. Bursa maybe.
What do you think?
What do I think?
Yeah.
Well, I was writing down trochanteric bursitis just as something to kind of look into
Okay.
as I kind of sit here and I hypothesize on what's going on.
Yeah.
But I definitely need to do some more tests and measures for that.
I've also noticed like pain increases with like certain sex positions too.
Sex positions, okay. What kind of position?
Like I thought you would want to ask me more about that. I really don't like to talk about sex, but maybe physical therapy can offer me new positions. I'm not too old to learn new things, and don't tell me to put ice on it or to stop the mood, not the pain.
Okay.
My friend said he enjoyed the pictures and the sex position instructions from you after his total hip, but I don't want any restrictions. My wife would not like that. Now are you just going to ignore these requests as I really want to talk about it? I see you're blushing and looking uncomfortable, but you're old enough to talk about sex even though you just graduated.
Okay. So some certain sex positions with your wife are flaring up that.
Yeah.
Okay. Do you know like what type of positions are those? Like is your leg out?
Yeah, it's kind of it's
like are you?
Yeah, it's.
Okay.
I think it's like when I'm on top, you know,
Okay.
and like I'm kind of.
So you're kind of really flexing those hips.
Yeah,
out
and
to
that's
the
kind
side.
of yeah.
Okay, that's understandable. Okay. All right. Yeah, we can definitely continue that conversation once we figure out, what's wrong and come up with a treatment plan and kind of explore those options.
Okay.
Does that sound good to you?
Yeah.
Okay, so I just want to take a quick moment and just read these things back to you and make sure I didn't miss anything or assume anything, and feel free to add anything along the way. Okay.
Okay.
So you're coming in for right hip pain. It's kind of on the side. Started about 3 months ago when you're running a marathon with your wife. You feel as if it's getting worse the past 2 weeks because you're continuing to run and do the Stairmaster on it, which are also the symptoms or the activities that cause the symptoms. It's more of an achy pain, but once in a while you feel sharp pain, especially when running. You also feel a snapping sensation when climbing the stairs. You're an accountant, and you're having some trouble with some certain sex positions.
Yeah, I also have asthma.
Yeah, asthma.
And yeah, I use an inhaler.
Okay. Anything else you need to add to this?
No.
No? Okay. All right. So what I want to do first is just take a quick vitals check. I'm just gonna check your blood pressure and your heart rate and things like that. Okay. Figure out the same time. Nope. Oh, yeah, let's say something. Where did you go to school to be an accountant at?
University of Miami.
Miami. Alright. Just relax. Your blood pressure is 138 over 85.
110 over 64.
110 over 64. That is awfully low. Okay, next thing I'm just gonna get your heart rate, and if you could just cross that arm across your stomach for me.
Yeah.
No, this one.
Sorry.
Yep, there you go. And then just relax for me. Relax. Okay. So heart rate was at 70. Respiration was at 17.
So pulse 76, respiration 14.
Alright. Okay, next I want to just go ahead and start out like with just a general screen to see how you're moving and make sure everything's balanced, okay?
Okay.
Alright, so the first thing I want you to do is go ahead and you can stand up, just kind of right where you are. If you don't mind removing your shirt for me. And then you can turn around and face that other side. You just move the chair away a little bit. Alright. Okay, so when I tell you to go for it, all I want you to do is kind of bring your leg up, and we're going to do one at a time, okay? We'll start with the left one.
Okay.
So just wait for 1 second. Press it down. Okay, so go ahead and do the left one. Good. Go back down and do the right one. Okay, good. All right, good. Okay. So now the next thing I want you to do is we're gonna kind of just bend forward. So I want you to start at your neck and kind of curl your neck down, and then slowly just try to touch your toes, okay? But if anything hurts, if it flares anything up, just come back up and we can move on, okay? All right, go ahead and do that. Okay, and come back up. All right, good. Okay, that's fine. Next, can you just have a seat right here on the table for me? Okay, so all I want you to do with this one is to just go ahead and kind of kick your knee out as straight as you can go. We'll start with the left. Good. Can you do it one more time for me? Yeah, and the other one more time. Okay, great. And then kind of scoot forward a little bit more on the table, and we're going to try to bring that knee back as far as you can go. Okay. Maybe stand up because this wire is getting in there. And I'll kind of just have one hand on you to balance. Yep, and do your right leg. Good. And go to the left leg. Okay, good. You have any pain with any of those motions? No? Okay. Can you, kind of like what we did with that first test, can you just bring your leg up as high as you can go? Your knee up. Good. You have any pain with that or anything?
No.
Okay, and your other one? Any pain with that?
No.
No? Okay.
Looks a little restricted, like less than the left.
Okay. So the right one's just a little restricted, but no pain?
No pain.
You can hang on to the table, and we're just going to go out to the side. Yep. Good. Any pain with that?
Pain, right hip, limited.
Okay. So. And you said also pain as well?
Pain, yes.
Pain. Okay. And what about the other side?
On the other side.
Yeah, go ahead and just do the
Oh,
other
okay.
side then.
Yeah.
Yep. Okay, good.
The
Anything
normal
with
limits.
left one's good? Okay. What about if you take your right one and kind of come across your left leg? Yeah, how's that?
Pain.
Pain with that?
On the right, yeah.
Okay,
Limited.
Limited a little bit too? Okay, and go for the left one, same thing? Anything in that?
Within normal limits.
Okay. What about kind of kicking back out as far as you can go? Try to stand up as straight as you can.
Okay. Within normal limits, left.
Okay, and go to the right one?
And pain. Or, I'm sorry, limitation.
Yeah.
Right.
Okay. Go ahead and have another seat on the table for me. And now for this one, I just want you to bring your foot in and then out. In, good, and out.
The normal limits.
Okay, and your right side in.
That's the, yeah. And then, so, restricted.
Okay.
And restricted.
Okay, so internal. Any pain with those two?
No.
Alright, good. Okay. Can you go ahead and just stand up one more time if you don't mind to remove your shoes and socks? Okay. Alright, okay. So what I want to do is just kind of perform like a little structural inspection and just see how, make sure everything's even in line. So I'll kind of just start up at your shoulders and I'll just go ahead and look. Okay. Shoulders good. Okay. Sides. Any fun?
Yeah, it's
Okay. Do you have any? Okay. Have you ever had any problems with your knees or anything? I noticed they're kind of flat.
yeah, but no.
No, like diagnosis or anything.
No.
No. Okay. Alright. Okay. Alright.
So what did you look at?
So I was looking at kind of starting at the top, just making sure that your chromiums were kind of level, relatively, the ASIS, PSIS, as well as your knees, kind of like looking at the fibular head and.
Okay, so fibula in your head, greater troch, and iliac crest are lower than the left.
Okay. So fib head, greater troch, iliac crest are lower than the left side.
Yeah.
Okay.
And then hind foot pronation on the right foot.
Okay. All right. Okay. We're gonna go ahead and hop up on the table. Okay, and you can go ahead and just lay down. Okay, so I just want to kind of feel around that hip a little bit. Okay. Okay, so I'm just looking for any like atrophy or any abnormal muscle bulk, as well as like any swelling, and then I can feel a little bit of heat for increase in temperature around that.
Slight warmth.
Okay. So a little warm.
Right lateral aspect.
All right, good. Okay. So I just want to take a couple measurements. First, I'm gonna have you kind of perform the movements, and then I will do them passively. Okay. So to start, we're just gonna start out. I just want you to try to bring your knee up to your face as far as you can go. Okay. You can put your foot down on the table. Yeah. You have anything with that?
No.
No? Okay. Good. So I'm just gonna apply a little bit of overpressure. Any pain or anything with that?
No.
No? Good. Okay, so landmarks are the greater trochanter with the stationary arm up the side of the abdomen and the movement arm in line with the fibular head. Okay. Right, so I got 126 degrees.
What's that for? Hip flexion?
Yeah. That can't be right now. That's looking like 95 degrees.
Alright, hip flexion 120.
120. That's right. You have any pain with that?
No.
Okay. You can go ahead and relax this leg real quick, and then maybe kind of angle your body over on this side a little bit. If you can just scoot your body over here. Yep. And then I want you to just bring this leg out as far as you can go. And then I'll kind of support it. Do you have any pain with that?
No.
No?
Oh, sorry. Abduction, yes, pain.
Some pain? Okay. Alright. Same type of pain that you've been experiencing?
Yes.
Okay, so landmarks is going to be the ASIS, stationary in line with the opposite ASIS, and the movement arm in line, splitting the quad down in relation to the patella. Okay, so I'm getting 127.
30.
Okay, because I got started in the 25, 30. Right. And then what about just bringing your leg over to your other leg as far as you can. Kind of don't cross them, just bring this leg out a little bit. Yep, and then you bring this one. Yeah, bring this one over. How's that? Any pain with that?
Pain.
Yeah. Okay. So you can relax your leg. So landmarks. So I'm getting like 12 degrees.
10.
10. And then can you go ahead and flip over on your stomach for me real quick? Okay. So what I want you to do is I want you to try to, let me go over the other side. I want you to try to bring kind of this leg up to the roof as far as you can go. If that makes sense. Good. Do you have any pain with that?
No.
No pain? Okay, I'm just gonna do a lot of pressure. Good. Alright, I'll support you right here. Alright. So greater trochanter for the fulcrum, movement stationary arm in line with the trunk, movement arm with the fibular head. Alright. And you can relax. So I'm getting about 5 degrees of extension.
7.
7. Okay, and then can you just have a seat on the end of the table over here? Sweet. All right, can you just bring your right leg, your right foot in for me? Any pain with that?
No. No.
No pain with that? Okay, I'm just gonna apply a little pressure. Good. And you can relax. Okay, so got the from the LS movement arm, stationary arm is straight to the ground, movement arm down the tibia in relation in between the medial and malleolus. So I got 35 degrees of external rotation,
It's 36.
36 of external, and then we're gonna go the opposite way now, so try to bring your foot out. Good. You have anything with that?
No.
No? Okay, relax. Okay, I'm getting 16 degrees.
15.
15 degrees. Okay. All right. So now I'm just gonna go ahead and do the same thing, but you just relax, and I'll be with you. Okay.
Okay.
Right. Okay. You have any pain with that?
No.
Okay, so passively I'm getting 34 degrees of external rotation. 40 degrees. Okay. And the same way. What about this? Any pain with that at all?
No.
No? Doing alright? Can I keep going?
Yes.
Okay. I'm getting 24 degrees of internal.
20.
20 degrees. 20 internal. Okay. Alright. Okay, so now we're going to go ahead and lay down one more time for me. You okay with that? I got 110 degrees.
125.
125, no pain. Okay.
It's a normal capsuline feel.
Oh, yeah. Okay.
Normal ERIR.
Abnormal capsule or muscle?
Muscle, sorry.
For both?
Yeah.
Yeah. Alright. And kind of angle yourself over that one more time. Good. And you can just relax both legs. Doing alright with that?
Yes.
Any pain?
No.
Okay.
Yes. Abduction, yes.
Yeah, okay. Let's see, that's some pain. And it kind of felt like I have normal muscle infill, and I'm getting 62 degrees.
Normal capsular infield, 45 degrees.
Okay. Maybe come back my way one more time for me. Good. Bring this leg all the way over as far as you can go. Good. And then just go ahead and bring this. You okay with that? Any pain?
Pain.
Pain. Okay. felt like a normal capsule infield.
Abnormal muscle infield.
Okay, and I'm getting about 15 degrees.
15 degrees.
15. Pain, abnormal muscle.
Yes.
Okay. And then one more time, if you can just flip over on your stomach for me. Okay, so you just relax. Any pain with that?
No.
Okay. So it's looking about 15 degrees of extension.
12.
12 degrees, no pain. I felt the normal capsule infield.
No, that's
12. So these are normal. Okay. So I got abduction, pain and limited. Or sorry, I got adduction, pain and limited. Internal and external pain and limited. Is that correct?
Yeah.
Yeah. Right. Okay, so go ahead and flip back over, if you don't mind. Put your hand in this pillow. Alright. Alright. So I need to get my hands as closest to that joint as you can. So whatever you're comfortable with, can you just move my hands down? Okay. And just relax. You have any pain with that?
No.
No? Okay. Felt like a normal capsule infield to me.
Normal.
Normal. Okay. I'm gonna do. Okay, so that was inferior. Okay. That was inferior glide. Yeah. Do distraction. Felt like a normal amount of movement, normal capsule infield. You have any pain? Normal. No pain either, right? For
Right.
both of those? So just like with that first one that I did, I need to also get my hands again as close as you can, but this time at a little angle. Okay. Really good. Think for your lateral stretch. Any change in symptoms? No? Normal capsule feel?
Yeah.
Okay. So I gotta do one more the same way. Yes, yeah. And then medial. You sure your symptoms of that?
Normal.
Okay, so that was medial. Normal capsule feel. Normal amount of motion. Okay, you can relax that leg for me. And this will be a anterior stretch. Any symptoms of that?
No.
No? Normal line of motion? Normal capsule? Okay, and then, okay, one more to do. We're gonna go across. Can you scoot towards me a little bit? Thank you. And kind of roll over towards me. Good. And come back. So this will be a posterior stretch. Chin symptoms of that?
No.
Feel like a normal hand motion. Normal capsule feel. Say 40 minutes or 45?
45.
45? Alright. Go ahead and I want you to sit on the edge with your feet off and you can kind of prop yourself up. Yeah, like that. Alright, so for these I'm just going to be applying just a very light resistance. I just want you to match me and I want you to let me know if you feel any pain with it. Okay. Alright, so we'll just go ahead and start up here. Good. Remember to let me know, okay?
Okay.
Good, so that felt strong. Anything with that? Felt strong. Okay, felt strong. Felt strong. Felt strong. Felt strong. Felt strong.
Normal.
Normal. Okay. Alright. Alright. Let's go ahead and you can stand up and come over to this edge over here. And I'm gonna have you kind of with your kind of your buttocks up against that. Good. Okay. So with that opposite leg, I would just want you to reach up and grab it behind it. Yep. Good. And we're gonna slowly lower you. Okay. Yep. Breathing out. Okay. And go ahead and come back. Good. Good. Right. And you just relax. Okay. So you got parallel to the table. Looks like normal quads. I'm gonna do this one more time. Bent. Okay. So looks like your quadricep is a little tight and looks to be pretty aligned. Maybe a little externally rotated, which would be TFL. You can go ahead and hop up.
So it's positive over reproduction of pain. Or sorry, positive Thomas.
Yeah.
Tight rec fem.
Accurate.
70 degrees on right.
Okay, nothing with TFL or supporters. No. Okay. Alright, so now I need you can lie down facing the TB, so kind of on your side. Yep. Good. And you just go ahead and relax. Okay, you can relax. Felt it got to a little bit below parallel before I felt your pelvis move, so should be a normal length for TFL.
So positive over lateral hip pain.
Okay, so just pain, but not limited.
No, well, positive.
Okay, so limited to. Okay, and one more to do. If you can just lie on your back for me, one more time. Do you have any pain in your knee that outside of this?
No.
Okay. So I'm just gonna go ahead and lift your leg up and see, kind of check your hamstring length. Okay. Let me know if you have any pain or anything. Okay. Okay. Yeah. Good. Okay. So you're already at 90. Did you feel a stretch?
Yeah.
Okay, well, can you point to where? Yeah. Okay. Well, that was definitely pretty much to 90, so I would say they're normal length.
Yeah.
Okay, so good with that. Alright, let's see. Okay. Yeah, go ahead and have a seat one more time. So I just want you to bring this knee up as far as you can go. Good. You have any pain with that?
No.
No? I want you to hold right there. Don't let me move you and don't forget to breathe. Good. Okay, felt strong. You okay?
Yeah.
Okay, and come back up about halfway. Good. Hold right there. Don't let me move you. Don't forget to breathe. Good. So those feel strong.
5 out of 5.
Yep. Okay. Okay. I want you to bring your foot out. Good. Can you hold right there? Don't let me move you. Don't forget to breathe. Good. Bring it in for me. Hold right there. Don't let me move you. Good. Good with
5.
us. Yeah. Okay. Kind of figure that.
So 5 hip flexors, 5 IR,
Mm-hmm.
ER pain, lateral hip region with moderate resistance.
Okay. All right. Go ahead and we can lay down one more time. Okay. I want you to kind of do this motion for me. Can you do that? Good. Okay. I want you to hold right there. Don't move you. Don't forget to breathe. Okay. Good. Good. Strong as that. Okay. Now just stay in that one position for me. Sorry. Yep. And just relax your leg. Okay.
Okay.
All right. You have anything with that?
No.
Okay. Okay, kind of just. Okay. How was that favor?
I don't have any favor data.
Nothing. Okay. All right. You can lay back down again. Okay, and you just go ahead and relax. Okay. Do you anything?
It's negative, I think, for that.
Nice to do. Do the other one. Okay, I didn't feel any clicking catch or anything like that or pain.
So the scouring was negative.
Okay, I didn't do the scouring yet.
Or no,
That-
scouring unable to assess.
That was Fadir and
Or-
posterior
okay.
labrum.
Yeah.
Good.
I don't have data on. Yeah.
Okay. And scouring, you said was negative?
Unable to assess.
Okay. Okay, go ahead and lay down one more time for me. You can lay to center. Okay. 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 So I'm just gonna apply some pressure moving in. You let me know if you have any pain at all. Okay. Okay. Any pain with that?
No.
Any pain with
No.
that? Same thing, making it out. Any pain with that?
No. No.
Okay. Can you go ahead and come up into the sitting position for me? Okay. Go back down laying one more time. Okay. All right.